unravel the mysteries of the mind in a journey through the intricate world of dementia. From the relentless progression of Alzheimer's to the subtle nuances of depression within its grasp, our video dives into these complexities. Join us as we clarify misconceptions and guide you through how you can help your loved ones through these difficult times.
Welcome to My Ageful Living. Join us on the My Ageful Living channel, dedicated to all things relevant for those in their golden years and beyond. Life in our 50s and beyond is brimming with possibilities, and we're here to share our insights and experiences with you. Let's embark on this journey together and explore the richness of ageful living. Hit that subscribe button, and let's make these years truly golden.
Alzheimer and other dementias. Part 1. Overview. Dementia is a complex and multifaceted term encompassing a group of symptoms that affect memory, thinking, and social abilities to a degree that hinders daily life. It's not a single disease, but rather an umbrella term for various brain disorders causing progressive cognitive decline. It is characterized by a decline in cognitive function that goes beyond what might be expected from normal aging. It mainly affects older people, but not all people will get it as they age. Dementia can be caused by various factors such as age, high blood pressure, high blood sugar, smoking, depression and more. Alzheimer's disease is the most common form of dementia and may contribute to 60 to 70% of cases. Vascular dementia is caused by reduced blood flow to the brain due to damaged blood vessels. It is the second most common cause of dementia, according to WHO's 2019 report. It is currently the seventh leading cause of death and one of the major causes of disability and dependency among older people globally. The significance of dementia lies in its impact on individuals, families, and society. It affects memory, thinking, orientation, comprehension, calculation, learning capacity, language, and judgment. Many see this as a change in personality of the sufferer. Key concepts. Neurodegeneration. Neurons are the basic building blocks of the nervous system. This refers to the progressive loss of nerve cells and their connections in the brain. Different brain regions are affected depending on the type of dementia, leading to specific cognitive impairments. Abnormal protein aggregates in the brain, commonly associated with Alzheimer's disease. These contribute to the disruption of normal brain function and the death of brain cells. Synaptic dysfunction. Communication between neurons occurs at synapses, tiny junctions where neurotransmitters relay signals. In dementia, these synapses become dysfunctional, disrupting information flow and impairing cognitive function. Cognitive decline. This is the hallmark symptom of dementia, encompassing memory loss, difficulty thinking and reasoning, impaired language skills, and problems with visuospatial abilities. Progressive nature. Dementia symptoms worsen gradually over time, eventually leading to significant dependence on others for daily activities. Causes. The exact cause of protein aggregation in Alzheimer's disease is not fully understood, but scientists have identified two main proteins involved: beta-amyloid and tau-34. Beta-amyloid is a fragment of a larger protein called amyloid precursor protein, APP, which is involved in neuronal growth and repair. Tau is a protein that stabilizes the microtubules, which are structures that transport nutrients and molecules within the neurons. In Alzheimer's disease, both beta-amyloid and tau undergo abnormal changes that make them prone to aggregation. Beta-amyloid fragments clump together to form insoluble plaques outside the neurons, while tau molecules detach from the microtubules and form tangled filaments inside the neurons. These aggregates disrupt the communication and metabolism of the neurons, leading to their death and cognitive impairment. Symptoms of Alzheimer's disease: memory loss that affects daily life, such as forgetting important dates, events, or names, difficulty in planning, solving problems, or making decisions, such as managing finances or following a recipe, confusion about time or place, such as losing track of the seasons, dates, or locations, trouble with language, such as finding the right words, understanding what others say, or joining a conversation. Changes in mood or personality, such as becoming increasingly irritable, anxious, depressed, or withdrawn, loss of interest or initiative in activities that used to be enjoyable or meaningful. These symptoms may vary from person to person and may get worse over time. If you or someone you know is experiencing any of these symptoms, it is important to consult a doctor for a proper diagnosis and treatment. Depression in Alzheimer's sufferers. Depression is a common symptom in Alzheimer's disease, with up to 40% of Alzheimer's patients experiencing depression. It often occurs during the early and middle stages of the disease. However, diagnosing depression in Alzheimer's patients can be challenging due to the overlap of symptoms between the two conditions, such as apathy, loss of interest in activities, social withdrawal, trouble concentrating, and impaired thinking. Depression in Alzheimer's patients may present differently than in those without Alzheimer's. It may be less severe, may not last as long, and symptoms may come and go. The cognitive impairment experienced by Alzheimer's patients often makes it difficult for them to articulate their feelings associated with depression. Treatment for depression in Alzheimer's often involves a combination of medication, counseling, and gradual reconnection to activities and people that bring happiness. Medications typically include serotonin-specific reuptake inhibitors (SSRI). Non-medication approaches, such as cognitive behavioral therapy (CBT), may also be helpful. However, emerging research suggests that non-drug, psychosocial interventions may be the most effective treatments for depression or anxiety in older adults with cognitive impairment. It's important for caregivers to discuss any signs of depression with the primary doctor of the person with dementia for proper diagnosis and treatment. This can improve the patient's sense of well-being and function. Common misconceptions. Myth: dementia is a normal part of aging. Fact: while cognitive decline is common with age, dementia is not a normal consequence of aging and indicates an underlying brain disorder. Myth: people with dementia are forgetful, but otherwise fine. Fact: dementia affects various cognitive domains beyond just memory, impacting thinking, reasoning, language, and behavior. Myth: dementia is untreatable. Fact: while there is no cure for dementia, treatments can manage symptoms, improve quality of life, and slow disease progression. Myth: dementia is purely genetic. Fact: although there is a genetic component to some forms of dementia, the majority of cases do not have a strong genetic link. Myth: dementia is contagious. Fact: dementia is not contagious and cannot be passed from person to person. End of Part 1. In Part 2, we will cover caring for someone with Alzheimer's disease, stages of Alzheimer's and cause of death, life expectancy, ongoing debates, discoveries, and advanced theories. Conclusion.
If you're enjoying the video, give it a thumbs up. And if you haven't already, consider subscribing and hitting that notification bell. Join the My Ageful Living channel, we would love to have you, your support means a lot to us. Hit the like button, hit subscribe, and let's keep this awesome community growing. Got any thoughts? Drop them in the comments. Thanks for being part of the My Ageful Living community.